Good morning, ladies and gentlemen, and welcome to the Reducing the Stigma webinar hosted by Lake Superior Quality Innovation Network. Our speaker for today is Ms. Karen Herring. Ms. Karen Herring, you may now begin.
Hello, everyone. This is Karen Herring with MPRO, Michigan's quality improvement organization that is part of the Lake Superior Quality Innovation Network, or Lake Superior CLIN. Lake Superior CLIN represents Minnesota, Michigan, and Wisconsin under the Centers for Medicare and Medicaid Services Quality Improvement Organization program. Today's educational session is entitled Reducing the Stigma, What People Struggling with Addiction Want Clinicians to Know. The stigma associated with substance misuse and addiction has an impact on recovery from many different perspectives. It damages self-esteem, which can make a person reluctant to seek help. It can also cloud how clinicians provide care. Family, friends, and the public can also contribute to the stigma with a lack of empathy for those struggling with the disease. This webinar will discuss how empathy in the treatment of drug addictions can help facilitate recovery. This webinar is part 6 in the series on the opioid crisis. Before I introduce our speaker, I'll mention that all lines are muted during this webinar. However, after the presentation, we will have a time for questions and answers. So please make a note of any questions that may come up as you listen. Or you may use the chat feature, which is on the right side of your screen. Also, because Metastar is providing continuing education credit for this presentation, we need to inform you that no commercial support has been received for this learning activity. The speakers and planners have no conflicts of interest. For CEs or a certificate of attendance, you must attend the entire session and complete an online evaluation. You will receive an evaluation link at the end of today's session. We encourage everyone to complete the evaluation to provide feedback on the session. Now I'd like to introduce our speaker, Judge Linda Davis. Judge Davis has presided over cases of the 41B District Court in Mount Clemens, Michigan since 2000. In 2011, she implemented a drug sobriety court in the same district. She has played a crucial role in the inception of Families Against Narcotics, Hope Not Handcuffs, and Operation RX, and continues to be instrumental in the success and growth of these organizations. Judge Davis is active in her community and is involved with educating clinicians, lawyers, and the public regarding prescription drug use. At the state level, she was appointed by the governor as the chairperson of the Prescription Drug and Opioid Abuse Commission. At the national level, Judge Davis has presented with Vizient in a webinar reaching out to the medical community across the nation. Judge Davis has also been invited to the White House on several occasions, including as an advisor to the First Lady on the issues facing the nation regarding opioid abuse. We are very fortunate to have her be present and be the voice for those struggling with addiction. Judge Davis, I'll now turn it over to you.
Thank you. I'm really pleased to be here with all of you today. Let me tell you a little bit about the organization that I run. I have been a judge for 18 years now. I've been running a successful drug court for a period of time. But probably the one thing that I'm most proud about is the organization of Families Against Narcotics. We noticed in our community about 11 years ago that we were seeing a number of young people coming into our court system, kids that had never been involved in legal issues before, usually for retail frauds. And upon investigation on those cases, found that many of them were suffering from opiate addiction, either prescription drugs and or heroin addiction. This was unheard of in our community. We lived in a pretty well-to-do community. I had never seen heroin or prescription drug problems, and at that time we really and truly thought this was just a local problem. It ended up that we lost 9 young people to death in a very short period of time, and our community got together and held a town hall meeting, and out of that was born Families Against Narcotics. We still thought this was just a local problem. We did not realize it was a national problem, and we began educating in our schools, and the more we educated, we were getting calls from all over the state to do presentations, and we realized this was something that all communities were facing. So we started a program, and I think that most of you probably know the statistics or you would not be on here. We have over 2 million Americans that currently struggle with an opiate addiction. I think there's a lot of things that go into that, but clearly prescription drugs is at the root of a lot of this. Addiction is affecting everybody in our community. It's affecting young people, middle-aged people, and the elderly. And it's surprising to me because this was something that we always have this image of somebody who's an addict is living underneath a bridge, being homeless, poverty-stricken, and addiction has changed. That's not to minimize the fact that people that are in those positions may not have at one time lived under a bridge. I always say that if there's anything good that's come out of this epidemic of addiction, it's that we are learning more. We're realizing that this is a brain disease, and what we see when people present themselves in front of us, whether it's me as a judge or you as doctors or nurses in the medical field or police officers, the person you're seeing at that time is really not the person that's presenting themselves. Once addiction takes over, it hijacks your brain, and you become somebody that is almost unrecognizable to family and friends. I went through this with my own child who suffered from an addiction, and at the time that she was in the throes of addiction, I did not know who she was. Behavior was different. She looked different. She acted different. It was not who she was raised to be, and I think that's really important whenever we're talking about substance use disorder, that we realize that underneath that addict is a person who had dreams, who had a vision for what their life was going to be, and addiction was not a part of that. I have yet to meet, and I work with thousands of addicts all over Michigan and across the nation. I have yet to meet an addict that is happy with their life and that it was their goal in life to become an addict when they started out. We all think that bad things won't happen to us, and I think that's true for addiction too. People who are alcoholics, when they pick up that first drink, don't ever think about drinking being a problem. Well, that's also true with addiction to prescription drugs and heroin. It's also a line that people cross, that most people think that that addiction is something that happens to somebody else that could never happen to them. With prescription drugs being as strong as they are now, we're starting to see, and we get a lot of notoriety in the media about stars, Prince, people like that who have suffered from addiction, and they are nice people with wonderful careers, and we always wonder, well, why are they doing that to themselves? And we need to get past that and realize that addiction is not a choice. It is a brain disease, and until we start treating it like a disease, just like we would any other disease, we are not going to make big strides in this area, and people will be hesitant to come forth and ask for treatment. Drug abuse affects society and all of us in ways that we don't even think about. Crime goes up. It impacts families. Families that are faced with addiction almost become dysfunctional. They're so focused on their loved one with the addiction that they start themselves isolating themselves from friends and family, questioning God, doing all of those kind of things that young people and people with addictions do that also spills over into their family. We know that it affects society. Crime rate goes up. There are more thefts in areas where drug addiction is high. And it's an incredible strain on not only employment. I talk to employers all the time that say right now they've quit drug testing because they can't keep a workforce because so many individuals in their employment are actually using drugs, and they would have to fire their whole workforce, and they can't afford to do that. And that's to say nothing of the strain that it is on the healthcare system. I think we know in our daily work that this is something that happens way too much in the emergency rooms. It's a drain not only in time but also in the finances of what's happening around the country. It's pretty astounding when we stop to think about every 15 minutes in America a baby is born with neonatal abstinence syndrome. These are children that are starting out life already affected by the throes of addiction. Fortunately, many of them recover, but we also see many of them that have birth defects that are going to have special needs for many years to come. And it's something that has really been ignored when we talk about addiction. Fortunately, because the epidemic is so big, a lot of resources are being into making sure that pregnant women are treated properly that have addictions, that we aren't just scorning them and ignoring them and letting them live on the street, but we're actually trying to provide proper care for them, get them onto methadone and other drugs that are safe for them to take while they're pregnant, and then making sure that we are there for those babies when they're born to make sure that they enter this world with a good fighting chance of being successful. I'm not going to talk a lot about the graphs that are up here. I'm always opposed to people who show a slide and then read it to you. You can see that the neonatal abstinence syndrome is on the rise, especially in Michigan. Well, it's not just especially in Michigan, across the country, but these are Michigan statistics on that, which will show you from the year 2000 to now the increase in the number of children that are being born affected by this disease. Addiction leaves a wake of disaster in its path. I've already talked a little bit about that, but there also, that goes along with this, are problems in our society that we haven't had to face before. I remember years ago my daughter and I went to South Africa, and I was just astounded by the number of grandparents that were raising grandbabies. And the reason for that was because the parents there had died of AIDS. We are facing the same problem in the United States, but the parents are either have died of addiction or are in the throes of addiction and are not able to raise their children. And so we have grandparents. I actually have 3 friends of my own, my age, which I'm way too old to be parenting children, but they are raising sometimes 2 and 3 of their grandchildren because of addiction of the parents of that child, and they're unequipped to do this. They also are dealing with children who have suffered birth defects as a result of that, which is a real strain on the family unit itself. It also is linked to a lot of diseases like AIDS because of the dirty needle issue, hepatitis A, hepatitis C. All of those are on the rise at increasing and alarming rates. First responders can accidentally be exposed to dangerous drugs like fentanyl, and sometimes those drugs are fatal. We've had several incidences here in Michigan where first responders were hospitalized because they came into contact with fentanyl, and it had an effect on them. It also fosters homelessness and crime, and it costs businesses millions in dollars in lost work, lost wages, and lack of production. That's just a slide showing the number of people who are affected with addiction and the effects that it has on the workplace. And then the estimated cost of drug abuse in the United States, and this is including illegal drugs and alcohol, is more than $820 billion a year. And unfortunately, that is growing at an alarming rate. Drug overdose doses in 2017 killed 72,000 people. That was more than HIV, car crashes, and gun deaths together. And it's amazing to me when we talk about the stigma of addiction, I think this slide really hits home better than any. If you'll remember back to when we had the scare about Ebola, literally within weeks, hospitals had protocols of how are we going to deal with that. Hundreds of thousands of dollars were spent on making sure that we had protocols in place, that we were equipped, vaccines were being shipped into the United States. We were all on high alert. And yet the death rate for overdoses has been on the rise for at least 11 years now that I'm aware of, probably even before that. It's when I became aware. And yet we're just now starting to deal with protocols in hospitals of how do we treat effectively with somebody that comes in and presents themselves with an overdose in the ER. I think that in and of itself will show you the lack of compassion, the lack of understanding, and the stigma that goes along with addiction. So it's something that we all need to be aware of in the healthcare community, is that people are very hesitant to ask for help because of the stigma of addiction and the way that they are often treated when they come in. I told you a little bit about FAN. It has turned into a real movement in the state of Michigan and is starting to spread to other states in the United States. We now have 21 FAN chapters in the state of Michigan and 34 monthly support meetings. And that is a real service to the community because in each one of those areas, we institute new programs that not only assist family members. Sometimes people will say, well, FAN is just like a support group for families. And we are, because families are the part of this that oftentimes get neglected. So we do have monthly forums where families can come and learn about addiction, talk to other parents that have gone through this to figure out what worked, what didn't work. But more importantly, we also educate in our hospitals, our police departments. I myself speak at almost 200 venues a year trying to educate on the stigma of addiction and why it's so important to start treating this as a disease rather than a judgment of moral failing. We instituted a program about 18 months ago called Hope Not Handcuffs. That currently operates within eight communities, counties within Michigan, which is a very large area because Wayne County is included in that, which is one of our most populated areas. And we have over 61 police departments that are working, 67 police departments, that number grows every day, 67 police agencies that are working with us, and we are getting calls from all over the United States of people wanting to partner with us on Hope Not Handcuffs. It's a program where someone suffering from addiction can come into a police department. We train the police officers to be non-judgmental when they come in. Sometimes they just come in with only their own personal belongings, the clothes on their back, and say, you know, I'm living on the street, or I have an opiate addiction, I'm an alcoholic, and I'm ready to stop, I need help. They call our organization, and we have over 600 volunteer angels that respond within a 20-minute period of time, in most instances, to the police department. We've partnered with over 350 treatment facilities across the United States, and in about 99% of those cases, we are able to place someone into treatment that day. These are people that we follow up with, that we make sure that we are always staying in touch with them. We started alumni groups where people that come through the program that can then connect in their own communities with other people that are staying sober and working strong programs. The interesting thing about this is it really took a lot of cajoling to get the police departments on board to do this with us. We started in Macomb County. I had 4 police departments that had agreed to give it a try and to see how it would work. By the time we actually launched, which took us almost a year to get protocols together and get buy-in for the program in our community, by the time we launched, we had 31 police departments that joined forces with us, and they're now doing things like they'll do a traffic stop and find somebody with a needle on the seat that had just injected and used heroin. Rather than arresting that person on the way to the police department, they'll actually call a Hope Not Handcuffed angel, have them meet at the police department and agree not to bring criminal charges if they're willing to get into treatment. If they do that treatment successfully, then they work within the system to make sure that person does not go to jail. They don't ignore that this occurred, but it's something that can actually be held over their head that will encourage them to get into treatment. The program is spread beyond police departments. We now partner with 2 different hospitals in our community where when someone presents themselves at an ER, They have a social worker that talks to them. If they are willing to go into treatment, they call one of our angels, and we will actually meet them at the hospital to start the treatment process there. And we've also worked with CARE of Southeast Michigan, who also have peer recovery coaches in other hospitals in our community that do that same thing, and oftentimes will reach out to us if they are not able to find treatment for that individual. We track the people. We have 2-week follow-up, 1-month follow-up, 3-month follow-up, 6-month follow-up, 9-month follow-up, and a year follow-up, which is about the most we can do right now because it's a fairly new program. And it's amazing to us that about 60 to 70% of the people that come into the program are actually still working a recovery program and have not been arrested since they entered the program. In communities where programs like this are started, we oftentimes see that crime rates begin to drop. This program originated in Gloucester, Massachusetts. There was a police chief there that was just sick and tired of seeing young people in his community die, opened up his doors and started this program, which we have become a part of. We won an award last year for being the largest, most successful program in the United States to do a program like this. And it's helping people all over the state of Michigan access care. I have a video that I am going to play for you that kind of highlights that program, so I need to find out how to do that. Is somebody on the line that can help with that? Okay, I guess not. So maybe you won't get this. Yes.
Judge Davis, this is Karen. At the top of your screen, there should be a share screen button. It'll say File, Edit, and then Share.
Change the view. Share. Okay.
Right, and then as you go down, it'll say My Screen.
Yes.
And then that should allow you, there you go.
Okay, great. You may have to help me get out of that, though. Okay.
And then you're just going to want to go down to where your video is queued.
Okay. I don't see where that is at.
So you'll navigate to it on your own computer.
Okay.
Are you running it via Internet Explorer or are you running it via Chrome?
Internet Explorer.
So you'll just pull up the video in your browser then.
Okay. Oh, I lost you altogether now. Uh-oh.
We still see you.
Oh, you do? Okay. Yeah. I don't see you. All right. You're sharing your screen.
Judge Davis, if you want to give me the ball, Karen the ball, then I can share it. I have it queued up on mine.
Okay, that would be great. Thank you.
Sure. So you're going to go over to the side. Do you see where the chat window is?
Hi, it's Jennifer with WebEx. I'll go ahead and pass the ball for you.
Okay.
Thank you so much.
Thank you.
Am I doing that?
Officials say they responded to 5 calls last night. 4 people were revived. 1 person did die.
Heroin addicts who seek help in Gloucester aren't being arrested. Instead, they're getting much-needed help. On assignment, spent a lot of time at the Gloucester Police Department observing its Angel Initiative. That's a program that places heroin addicts in treatment facilities. We made a conscious decision in Gloucester that we're done with an addict being formally challenged on it to be a sense of addiction. We're going to take that extra step and make sure that they get the treatment that they need.
Some time ago, one of our board members had put in a news clip about this program that began in Gloucester, Massachusetts. And she was amazed by this program and how creative it was and thought, wow, you guys got to see this. You know, look at what this chief of police is doing. And we loved it. We were amazed by it. Hope Down Hancock is a resource, initiative by Clinicians where someone can walk into the police department. We currently have 33 enrolled in the program. They can walk in and ask for help. That officer on duty then makes one phone call to our Angel coordinator, and our Angel coordinator will then dispatch an angel to that particular police department. Usually within 15 to 20 minutes, and we'll help that person into finding them and treatment.
My name's Wilhelm. I started smoking pot when I was 12 or 13 years old. It progressed very quickly. I had my first drink when I was probably 14, and I didn't drink to fit in. I drank specifically to escape. Ran away from home when I was 15. Out there is when I was introduced to needle dope, heroin, cocaine, anything that you can break down to a needle. And then I don't know if I was at the right place at the right time, the wrong place at the wrong time, but I was at that place in life, you know. I never knew I was an addict because I could always put it out. I started with alcohol, marijuana, cocaine, and then it escalated into prescription pills. And in 2016, I started injecting heroin. And I never knew I was an addict until my life started falling apart when I started injecting heroin.
My name's Kyle. I'm 25 years old. I'm a son. I'm a brother. I'm a friend. And I'm a recovering man. My whole life, I've struggled with depression, anxiety, loneliness, anger, confusion. And to deal with those issues, I use alcohol, drugs to feel whole.
Someone that's struggling with addiction, they may feel lost. They may feel helpless and hopeless. And there is such a stigma surrounding addiction that they tend to isolate, and it's very difficult for them to reach out for help. We want them to know that our hands are outstretched, and we're here for you. Just grab it and let us help you.
It's a new thing for us. It's definitely a new thing for people who are seeking help coming to us for drug help, because that just wasn't our role in the past. Now we've had the facility where everybody knows what this department is. Now they know that they can come in and tell us they need help and get some help pretty quick.
That's the last thing an addict wants to do, is walk into their enemy's home, because that's how we feel as addicts, that the police are our enemies, and they're not. They are out there trying to help us to save our lives.
We're here out doing this job to help people, and if we can help somebody recover or get some help for them, guide them into recovery, I think that would be that's the ultimate goal.
I was arrested by Clinton Township Police Department when I was laying in the bed that night and just shaking from being cold and withdrawing. I remembered a
a friend had told me about this program, Hope Not Handcuffs. Immediately after being released, I walked to the front counter and I said, I need help. Can you please call someone? And the police officer was there. They called Hope Not Handcuffs for me. And an angel came out and saved my life.
The angels are really the backbone of this program. We currently have 250 angels that are trained. This program would not survive without them. They are there. They jump. As soon as they receive a phone call, they are getting to that police department if they get a call in the middle of the night.
My name is Terry Braden. I've been an angel for Hope Not Handcuffs 28 runs now since it started on February 1st. And my first call was February 4th. A little apprehensive at first, but walking in and seeing somebody there in need, motherly instinct or whatever. You see somebody sitting there in bad shape, and you just want to help. My son battled with heroin addiction for almost 10 years. He had been in and out of rehab 11 times at that point. In 2016, he actually was in rehab twice, and both times he had to wait 15 days each time. He was actually here at my house the first day I went on call. Exactly 2 weeks later, he passed an overdose. I feel like I've gotten more out of it than they have, because they're such grateful people. They come in there and they just have a heart of gold, and you can't help but love them. And some of them don't smell that good, and they're not clean. Some of them come in with not a bag, not anything, and any part I can play in it feels like the greatest thing to me to be able to give back.
When they are able to make that connection with someone and know that they were personally responsible to guide them into treatment, it is the most unbelievable feeling in the world.
I hope one day to become an angel. That is my goal.
I don't have to do this alone. I have people who care about me. I got a job. I wake up for every day bright and early, make my bed every day. I answer the phone when my mom calls, so she's not having to be up all night worrying about me.
I look forward to tomorrow. I look forward to today. I don't dread waking up every day. I look forward to meeting new people. I look forward to receiving and sending a message.
I do realize in the depths of my soul and my heart, every fiber of my being, that me sitting here right now is nothing short of a gift. It's nothing short of a miracle.
I didn't walk in alone. I didn't walk out alone. And I owe a great deal of that to Hope Not Handcuffs and my support team.
This isn't a moral feeling. This is something that has happened to them, that they can recover. There is hope. And that's really what Hope Not Handcuffs stands for. Hope. We're here to give you hope.
Are we back on now?
Yes, you're back on, Judge Davis. I don't know if your screen is back on.
Yeah, I don't think it is. It said thanks for using it. So I don't know what the last thing is because I can't see it, but I just want to add a few things to this. The reason we presented that video is to show that there really is hope in recovery. Like I said earlier, all of us deal with individuals that are in the throes of addiction, and we sometimes forget that underneath that shell of a person, that people really are able to recover and get well and go back to living very productive lives. The young girl that was on there that wanted to be an angel is now celebrating 18 months of sobriety. She works full-time. She's a productive person in the community. She volunteers for our drug court. She hopes to be a peer coach for other people that are in the throes of addiction. And she's an incredible young woman. When she first came to us, you would have thought she was a throwaway kid, that she looked awful, she was unkempt, she was unclean. And yet if we can look beyond that for just a few seconds to realize that there's a person underneath there, that if we're willing to take a moment to give them a chance, they can really come back to being who they were meant to be and be very productive members of society. I remember when I first started doing work in the area of addiction, I picked up a book that was called Moments of Clarity, and it was short stories about individuals who were senators, people that represented Congress, movie stars, star athletes that found themselves in the throes of addiction, and they talked about the pain that their addiction caused and that many of them held friends while they passed away. Many of them were involved in accidents where they experienced near-death injuries. None of that caused them to get clean. It was one individual, oftentimes somebody that they didn't even know, that saw in them something that they had forgotten existed and gave them a moment of clarity that perhaps they could get their life back, their dreams back, their goals back. And that one person was the beginning of their road to recovery. Each and every one of us are in a unique position every day because we work with individuals that are suffering from addiction to provide help, to provide that moment of clarity for someone where we can tell them that we can help them get their lives back. And if we do that, then we can be the conduit to get that person into the road of recovery. We have to realize that this is a chronic disease, that relapses occur. One of the young men has been through our program 3 times. He's now on the road to recovery and seems to be sustaining it. But we can't play God in the world of addiction. We don't do that with any other disease. If somebody is a diabetic and they eat pumpkin pie on Thanksgiving, we don't say, well, you didn't do what you were told to do medically, so we're not going to provide treatment for you. I have a family member who suffered from lung cancer and continues to smoke. We may, in our minds, judge that and say, well, you know, gee whiz, what does he expect to happen? But his cancer comes back. When he goes to a hospital, there's not big judgment about it. They'll talk to him about it. But they continue to treat him with compassion, with thoughtfulness. That is not necessarily how people with addictions get treated. We have done a lot of work with our hospitals, with our medical communities here in Macomb County to get past that stigma of addiction. But when we did Hope Not Handcuffs, we actually did a survey with addicts and said, would you prefer to turn yourself into a hospital to get help, or would you pick a police department? And overwhelmingly, they said the police department, because they were never treated well when they went into emergency rooms. Now, that's not a judgment on my part, and I want to make that very clear. I have incredible respect for what the medical community does and the problems that you have to deal with. But I do think that that speaks or should ring loudly to us that we really need to do a lot of training in our hospitals and our emergency rooms so that these people are seen as people that can get help and will get help if we treat them with a little bit of respect and dignity. So that wraps up my presentation for today. I am glad to answer any questions that any of you might have. This is a topic that has many different spokes to it, and we found with FAN that every time we fix one area, we find 5 other areas that need to be fixed. I think it's always kind of comical when we tell addicts that if you want different results, you have to change what we're doing. But we've dealt with addiction in our country pretty much the same for the last 50 to 75 years. And yet we've really not changed the way we've dealt with addiction at all. We now are looking at new forms of treatment. We're getting more holistic in our approach with them. We're using medically assisted treatment programs. But when I listen to a young person say, I've been to 11 treatment facilities, and I come back out and within 72 hours I'm using again, that would tell me that we need to change what we're doing. When we have people, and I hear emergency room doctors say all the time, sometimes people will come in 3 times a week, the same person with an overdose, and yet we don't have protocols in hospitals that will change what we're doing when someone comes in with an overdose. Then we need to look at how the system is failing this population of people who are truly in need of medical, counseling attention, and support systems throughout our community, and make sure that we are doing our best to deal with this world of addiction. Are people able to ask questions, or will they be typed in?
Okay. Oh, yes, I'm sorry.
All right.
Ladies and gentlemen, if you have any questions right now, please press the number 1 on your keypad. If you have any questions, please press the number 1 on your keypad.
Thank you, operator. Judge Davis, this is Karen from MPRO. I just want to thank you again from the bottom of my heart for all of your work that you're doing and for speaking with us today and just shedding some light on reducing the stigma.
Thank you, Karen. I appreciate that.
We have our first question from Miss Cindy Schloss. Schloss, I'm sorry.
Okay. I work with older adults in Washtenaw County.
Okay.
And, you know, you kind of have, I feel like we have 2 cohorts. We have the ones that are 75 and older, where we don't even bring up the word addict, alcoholic with them because of the stigma that they perceive. You know, they raise a family, they own the house, all that kind of stuff. And we have to be really careful how we word things with them. But then yet we have the baby boomers that are coming that have probably, you know, possibly been in treatment, you know, drugs and alcohol were part of their youth and so forth. But it's difficult to get an older adult to, well, here's the problem. Recovery-oriented care, they don't consider the older adult. A lot of attitude could be, oh, Grandpa worked all his life, let him have a few drinks, it makes him happy. Well, not if he's falling down and getting hurt. So there's there's very little out there that is older adult specific to try to help these people.
Right, and that's one of the areas that we've really identified. We do have an older adult community where we have provided videos and education on them for addiction. And we found oftentimes with older adults that if you talk about addiction in general, and you do videos about the kinds of prescriptions that can cause addiction, oftentimes family members or that individual themselves will start to ask questions where you see something has clicked on. I agree with you. I think there are a lack of services for many, many areas that deal with addiction, and I think we're just at the brink of really looking at all of these different areas and understanding that addiction happens at all ages, and just because someone is older, and I take care of an elderly person, so I know what you're talking about, that we oftentimes think, well, what difference does it make? They're old. But we also need to decide quality of life when we're deciding those kind of issues, and keeping somebody up on drugs or prescriptions just just to minimize what they're going through isn't always the best solution. I am encouraged, however. I did deal with this elderly person that I take care of. She had fallen, and they would not prescribe her opiates because they realized that opiates had the same effect on her brain that a young adult whose brain is not developed because of the deterioration of the brain. Those drugs have a much stronger effect on an elderly person. And I think a lot of the education is going to have to be with doctors to understand the effect that they have on elderly people, and that they're not necessarily helping these elderly people. They actually may be creating other problems for them. So I appreciate your comment, and it's something that we are looking at on what resources can we provide to better educate the elderly.
Well, I have two other points, if I could, real quick. As far as medication goes, new medicines are tested on 20-something-year-old men, okay, and not, and so they're, thank you. Somebody just walked in the door. They're not, considering older adults, lack of lower water weight and body mass and that sort of thing, and they're being given the same dosage that they give a 25-year-old healthy young man.
Right.
So that's one thing that they need to work with. The other thing that I've been harping on, the two recovery things in our community, is the detox houses that we have. So they're all in older homes. The bedrooms are upstairs. The stairs are not the code. The stairs may not be lit properly that an older person would need. Bathrooms are upstairs. And I get them all to agree, but then I can't get them to the table to talk about what can we do? How can we get like a ranch-style home specifically for older adults and, or anybody else with a disability. So that's kind of where I keep beating my head against the wall.
Well, I appreciate your comments, and I still am sitting on the governor's commission, and we bring up new topics, new areas that need to be dealt with all the time, and I certainly will. I have a meeting on the 20th of this month. I will definitely be bringing these issues up and looking for solutions for you. So I appreciate you bringing that to the table.
Thank you.
Okay, thank you.
Bye.
Okay, our next question comes from Ms. Renee Sinich.
Hi.
Hi.
So I was just wondering, when people go to the police department and then an angel is called to come and help them, and they arrive at the police department, what do you guys do with them in the meantime? Like, if there's no treatment facilities that have openings for these people, what are you doing with them in the meantime then?
Well, we really don't have a lot of people that we are not able to place immediately. Occasionally, because of insurance or something like that, there will be a little bit of a glitch. We may have to wait until the next day to get them in. That happens more with private pay insurance than it does with our access center. We really work with our access centers, and some of you may be offended when I say this, but they give our program priority for placement because it has more benefits than just getting someone into treatment. It is erasing the stigma of addiction. It's involving law enforcement, which changes how people are viewing addiction. So we usually are able to find beds. And because we don't just resort to our local community for placement, we will provide airplane transportation to another state if need be rather than let someone suffer. When you're dealing with someone with an addiction, your window of opportunity is very small. You have to catch them when they're ready for treatment. And when someone is coming to you saying, I'm ready, I'm sick and tired of being sick and tired, and I want treatment, you need to be able to respond to that immediately. We are working at a state level on providing more treatment beds so that we are able to access that. We're also working on a system at the state which will identify every open bed in Michigan. Obviously, those things take time, but we're at least working in that direction so that when we start calling, we are not wasting time calling places that don't have beds, that we're actually calling people that can place people right away. In the rare cases that we do come across where we can't find beds, we find a safe living quarters for them That might be a family member. It might be a three-quarter house that will just take them for the night to make sure that they stay safe, that they're not using. We will work with doctors in our community to get Suboxone if necessary so that these people are not detoxing and in excruciating pain while we can get them beds. But that is a minor problem that we run into. Most people we are able to get into treatment that day.
Okay. Thank you.
You're welcome.
Operator, do we have any more questions in the queue?
I don't see anybody else at this moment.
Okay, thank you. We're at the top of the hour, so I am going to conclude this educational session. Again, Judge Davis, thank you so much for speaking with us today.
And thank you for having me. It's been a pleasure.
Thank you.
Okay.
When you exit the webinar, you'll see a pop-up screen that contains the evaluation access information. Please be sure to complete the evaluation if you would like CME, CNE, social work credit, or a certificate of attendance. Even if you don't want a certificate, please complete the evaluation as your feedback is very important to us. Again, when you exit, please access and complete the evaluation. We'd love to hear your feedback. If you have any questions about continuing education or the evaluation, please contact continuinged@metastar.com. The session was recorded and will be available on the Lake Superior Quinn website in about 2 weeks. Thank you all for participating and have a great afternoon.
Thank you, ladies and gentlemen. You may now hang up.